Sego Seguego. This is Dr. Sarah Rourke. I'm here with my cousin and lovely friend, Mary Herne. Welcome to Woman's Dance, Mary.
Yeah, Sarah. Happy to be back in the Aboriginal Outlaw Studios again.
Yeah, shout out to the dudes. They had a comedy show on Tuesday. I heard Josh brought down the house, but I haven't watched it yet. I have to get there. He goes to La Maison like the last Tuesday of every month. They have an open mic type of thing, and he goes and makes white people very uncomfortable. It's his job. So I didn't have like a written script for today. I had a lot of very interesting conversations in the last week, so I wanted maybe for you to weigh in on them. Some controversial topics that are of interest as of late. There's a lot going on in the news. Do you watch the news?
No.
No?
Watch the live news. I catch everything on my Google feed every so often, so, I kind of get snippets, but just for my mental health, I just don't.
No,
Try not to.
Yeah, I think a lot of people are doing that, like just keeping the barriers when it comes to the news, and I feel like everybody's kind of just flipping the switch or the button or touching the screen, trying not to focus on what's happening out in the world. But it was funny because I went to my mom's the other day and I was talking to her about abortion, and normally like we'll go back and forth about certain things, and I was like, that there's a very extremist view of what's happening with abortion. And she's like, what do you mean? And I was like, well, you could be miscarrying and be in like a dire strait, like you could be in dire situations, and because you're in a hospital that won't do a DNC because it's illegal, those women will die. And she's like, what? I would have died. And she was telling me all these stories about her pregnancies. And I was like, well, what do you think of that? And she's like, well, I don't think that's right. I'm like, but you think abortion's wrong and what the states are doing is wrong. And she's like, I do. And I was like, well, I think you really need to read into the extremist like legislation that's going through. So it was really interesting to me because I don't think people ever see the entire picture because they're flipping through or they just see snippets of it or a meme or yeah. So it was really crazy interesting to me that we actually had like a calm, really good conversation about it.
Right. No, because I follow along with some obstetricians on like Instagram, and most of the time they like kind of post some like dumb shit people have said there in regards to women's health, and they just kind of go on and be like, okay, let me clear that up for people who are listening there, because what this person is saying is like, misinformation, and it can be very damaging, especially to, certain women's health issues there that we're still trying to understand more, because, women's health hasn't been very well researched there for a long time. But when it comes to that, just how extreme these limitations there are, like in these anti-abortion states, is just, it has gotten so frustrating for that simple fact, because not everybody understands, like, okay, when you have an ectopic pregnancy, that fetus, if it's like actually a fetus, or it could just be kind of, because you can get what's called a Mulder pregnancy as well, which is basically cancer. It's not a baby that's growing, it's literally cancer cells growing, but it's throwing your HCG levels off the chart.
Right.
So, to basically allow this person, like, allow these cells to grow, you're risking people's lives. Okay. That baby's not going to live anyways, because it cannot survive in the fallopian tube. Your body, a woman's body in like the uterus is specifically designed to carry a baby. Nowhere else in your body is designed to do that. So, for them to allow these cells to keep growing and say, oh, no, you can't take care of this, you can't have this abortion there when you could bleed to death, it's just awful. So, because I have seen it firsthand when I was working in the operating room, on the weekends that we would have to do like procedures on the weekends, and one of them was an ectopic pregnancy, like it had ruptured. I just remember when we were setting up for this, actually, I think it was just getting my instruments all set up or something. They had already gotten into the process of opening this woman up. Like, it was just straight, like, we're getting her open. This is emergency.
Oh my God.
And I remember, I can clear, like to this day, I can remember the sound of blood hitting the floor because that's how much she was bleeding internally. And to, live with that memory and just imagining all these poor women that unfortunately live in these states, having to experience that. And I'm like, these traumatic cases they don't just affect the patient, they're affecting their families, but they can also affect the medical field, the medical professionals that are trying to take care of them. So,
Yeah, and I definitely think there is a stigma about even talking about it in our community, in many communities, and me as a mother who has a daughter and I have nieces, it's terrifying to me that the government and governments are trying to impose their own rules on my own body and on their bodies when they should have their bodily autonomy. Like I feel like it's really hard for me to envision a world where my daughter, like forbid she ever has an assault or she's in a position where she's not supported in her child and she makes that decision, that determination. Like I don't ever have any kind of, people can have their own religious views and whatever, but I feel like I am so very much against anybody regulating my body in any way, shape, or form. And I feel like all women should feel that and not want that, not think that's a protection for them. And I don't know, until it happens to them, they are able to make that decision because of their privilege or whatever, So it's really hard for me to fathom, and I don't think people really understand like the determinations in in Congress and like in those spaces, like how they're going to impact us directly in communities, because it'll be our people first, it'll be our people, it'll be brown people that will be marginalized or disenfranchised in those spaces first and foremost. I mean, we were sterilized right up until the 90s. So why would you think that that's a trustworthy space when we're trying to make healthcare trustworthy to protect our people? So I don't know, it is a heavy topic, and I wanted to bring it up with you because as a healthcare professional, and I work in Indigenous health, and I'm building curriculum that merges traditional knowledge and Western knowledge. Like it's so important to let people know that it's safe to have these conversations, because people aren't, or they are behind closed doors. Or me bringing it up to my mom when I didn't think she was going to be receptive to that kind of conversation. She surprised me, and I was like, well, that's awesome.
Right.
Like that was a good day,
Right.
So, yeah, it's a heavy burden to be, it's a heavy gift, but a heavy burden to be a woman today, I think.
It is. And I think one of the things that we get so bogged down with is that we often hear of people having such polarized views, and they just, I don't know, we often in the news, I feel like we're just having a hard time there with people being open-minded and seeing the other side of that conversation there, because I understand what they're trying, where they fall in that belief system as to why they think it is, but I just don't agree with banning abortion either. Because, abortion is healthcare in these situations, and I believe every woman has that right to decide, whether or not they want to carry a child there, especially in those cases there where, they've been sexually assaulted, it sucks. But I also believe, too, that you need open access to birth control. We need that to be easier for people to access, because some people have health issues that, for them to carry to term, or it's too much on their bodies. And, I have seen patients that are like, I've never had kids. I don't ever want to have kids, for me to even go through the process, because pregnancy takes a toll on your body. Some women are, some pregnancies are easier than others, but you can't guarantee that pregnancy is going to be easy,
Yeah, my pregnancy was really good until it wasn't.
Right? Right.
and I don't know, I'm never going to do that again. And when I look back at it and I have that choice, to bring children into this world, and like, I mean, the fucking news is so heavy right now. Like you got like anti-abortion, you got anti-trans legislation, you have school shootings. It's like, how do you even breathe as a mother right now? And for me, like, every day I take a little time to just be really grateful for being able to protect my daughter, and that our kids are safe, and that my nieces know how to talk to me about the things that they need, and they never have to like question that they're safe in our homes and in our families, you know, and to see like what's happening on the news that we don't want to watch it's just a really heavy cloud over families right now, you know, like it's a bit wild.
Yeah, absolutely.
So I'm about to homeschool. No. I don't know. So my daughter can turn out as nerdy as I am. Right. But hopefully not as antisocial. Oh my goodness.
Right.
So you're reading audiobooks, huh?
Well, I'm listening to the audiobooks there, but I haven't I've had interest in learning, you know, getting into like reading the audiobook game or something. I don't know. It's one of those things where I just cycle through like different interests and like, oh, maybe I could do that, and then spend money on that interest and then just not go anywhere with it.
It's a vicious cycle, isn't it?
It really is. And I don't know, because I have like this microphone, but it's, you know, it's there. If I want to start reading books, at least like, you know, make audio books there for my children there. It doesn't have to be anything that I market or, you know, start making money off of.
That's super fun though.
It is.
You could sing too. Maybe you could rap. I don't know.
I'm not good at rapping. I can rap along to a song, but to rap out of nowhere, I do not have that skill.
You don't got the flow.
I don't have the flow, man. I don't got the sick beats, okay?
I don't know.
I sing along in the car there, and then I'm also one of those people there that, you know, when I listen to my metal music there, I try to scream along with it, and yes. I don't have it all the time. I think I only have it when I'm at an actual metal show. You just feel it.
You can to your bones, to your core.
Oh, absolutely.
It's medicine.
It really is.
No, it's funny because my daughter, I'll have to send you the video, but like she's 4 and she's got this beautiful little plaid blue and navy blue and red dress on, and she's got pigtails, and she's sitting in this rocking chair next to her grandmother. And she's like, Mama, you go. And she goes, Grandma, you can go like this. And it was Rudolph the Red-Nosed Reindeer. And she's rocking back and forth. And she's going like this. And I'm like, and she's like, Grandma, this is rock and roll. And she turns it right up and starts going like this. And she's got her horns up. And I have a real good video of it. And she comes home. She's like, Mama, I only like rock and roll. I was like, I don't believe you. You like other music. She's like, but rock and roll is the best. And I'm like, you're the funniest kid. It's really fun to see how they adapt to things that they know you love, and they've always like headbanged in the kitchen, and we used to put her to sleep to Metallica, you know, and she's like, I want Sandman Metallica, Mama, put me to sleep. Like it was kind of he put it on as a joke, and then every night she'd ask for it and fall asleep on his shoulder. So we're well-rounded child she is.
No, Ross was kind of well-rounded for a little bit. Right now, he's kind of more into, like, the pop music there, so, you know, which is kind of funny. He does have some of his favorite songs that he used to listen to, like, growing up. It's, like, Zombie by, when Bad Wolves redid Zombie, we have a video of him singing along to that one.
Aww.
Yeah, so it was awesome. And then Jimmy, who just really seems to more adapt to what me and Andre are listening to. He'll piss off his brother and be like, because Andre will drive after picking them both up there. He'll like, hey, Luana, what do you want to listen to? And you can hear him like kind of work out the words for octane. So of course Ross would be like over there because it's just mad because it's not hits one.
That's so cute.
Yeah.
So I was wondering, there was this one question I was looking at earlier because I was looking up different questions for our podcast. And I was thinking, when you were younger, what would you tell your older self about who you are now?
I mean, or is it the other way around?
It might be the other way around.
Might be the other
yeah, yeah. Make sense of it now.
Make sense of it.
I put it out there, now make sense of it.
Right. What would I tell my younger self? Who I am now? Oh my goodness.
I know it's a big question. I should have sent them to you before. But I thought it was a good one.
So those things there, work on my improvisation here, because I do need some better, learn how to like adapt to conversation, I guess.
Okay, adapt.
But adapt. Time to adapt.
Yes.
You're deflecting now.
Yes.
I think what I would tell my younger self right now, that you're probably you're stronger than you think you've ever been, and you are starting to make things happen when you felt like nobody used to listen. So, but yeah, so.
No, I definitely see that not only in you but in myself. Like, I think now that I'm old. Now that I'm older, you know, like before I used to care so much about what everybody else thought, or I would really like defer to people about what was needed, or really wait for other people's opinions and validations, and I took so much time of my life doing that, right? And not thinking I was strong enough to move forward in a way that I was competent in, right? And confident and competent, you know, I kind of merge those words together. But I think the older you get, nobody tells you like how that growth finally hits you. And you're like, oh, I don't have to give a fuck what anybody else thinks. Oh, I can just do this because I'm capable and I'm brilliant and I can fucking move forward and make shit happen. And I was thinking about that when I heard that you went back to school for your migraine study, because I mean our family has been plagued with migraines our whole lives.
Right.
And I've seen it incapacitate not only myself but also our cousins. And yeah, we're cousins. But I think it's really been like such a hard road for us because everybody's just like, oh, it's just a headache. Go lay down. Go to bed. And it takes you out for the whole day. And even now, I'm on medication where I have to take it twice a day. And then I take another one when I start getting a headache. And it makes me feel like my brain's on fire.
Right.
Like it's the worst thing I've ever been through. And then like I lose like hours of my day. And then I'm finally okay, but I still feel like super groggy. So I wanted to hear about that work and what you're thinking about doing. I know you said you were talking about a support group.
Yeah. So and Christ, when did I start it? Yeah, it's been almost a year since I finished the program, actually. So I went to Thomas Jefferson University for their postmaster's certificate program for advanced headache diagnosis and management, and it was so eye-opening, like how little I knew about, you know, migraine and all these different other headache disorders, you know, because like you said, though, it's like not too many people know about it. Even like talking to other, like my fellow colleagues there, you know, unless you grew up experiencing migraine attacks, you know, you really didn't take the time to like, okay, how do I treat this? So you come at it from like a patient perspective. And then once you go through all of that schooling, you're like, okay, how do I tackle this from a provider perspective? Because you know that you don't want your patients to go through what you went through, especially when they are as severe as you have been, or as severe as, like, you know, Marcy, my sister, experienced, because she started around the age of 12, and like every single month with her period there, she would get a pretty severe attack. I think, yeah, because I actually wrote an article there for Headache Journal, you know, the Journal of Head and Face Pain. So, and that's finally in the final stretch there for that to be published.
Yeah,
so,
published.
I'm like, oh my goodness, I'm going to be a published professional.
It's amazing. Goals.
It is.
Someday I'll get there when I take the time.
Right. So, and it was really really fun program because, you know, you get to work with all these professionals that are, you know, experts in headache medicine. Like right now, I think they said that you have one headache professional per 60,000 patients. That's how small this field is right now.
Wow.
But from all the work that I've, like, you know, everything that I've seen with, you know, talking to people from like these different organizations, like this, it's really gaining traction because right now there's a few programs in the country. I think the one that I went to, like, really, they have advocates there with Coalition for Headache and Migraine Patients that are trying to get more people involved through IHS because Indigenous populations are, like, our prevalence rate is higher than the national average. They're also finding that men are, like, the female to male ratio is a little bit closer compared to the national average because right now it is 2-1, you know, female to male. So for every 2 females, there's 1 male that experiences migraine attacks. But, you know, they're finding that men our prevalence rate among men is a little bit higher. But because we're so underrepresented in studies that they can't really get like exact numbers on it. So, you know, I'm trying to gain more traction within our own community to be, you know, hey, let's start creating like a movement to make headache medicine more aware. I did that one PSA there for Akwesasne TV last summer, which I did get some interest there and some response to it, which was great. But I think, you know, moving forward, I would like to work on getting our own support group going. So.
Do you think it's because of, like, historically we didn't have as many, like, environmental influences and processed, like, food and like, we had, like, a very land-based living and we had clean air and clean water and all those things. Do you think that's, and in conjunction with, like, this is just my thinking, in conjunction with our DNA and the way that we are built as Indigenous people, do you think that they're counteracting each other and that may be one of the reasons why we have more migraines than others?
It's like such a new question to ask that even then I'm like, because migraine attacks are like, migraine is family, like there's that strong family link. There is also you can experience migraine attacks there from post-traumatic headaches, you know. So you're thinking like your TBI, concussions, you can develop it even if you haven't had a history. So, you know, because as far as like stress-wise, I mean, let's be honest, we're a pretty traumatized group at this point. I know right now there's such a movement there to heal from a lot of this trauma that I think, you know, tackling it from a mental health perspective, that will probably, you know, improve the rates or at least improve better control for people. Because if it's, the difference is like the frequency attacks there. So you have the infrequent. For the longest time, I would get them only like once every 2 years. Whereas you have some people that get it like anywhere from 1 to 14 days per month, which falls into that episodic. And then you have the chronic, which is 15 or more days out of the month to like pretty much every day.
Oh my God.
So
I can't imagine.
And the difference between episodic and chronic migraine there, they kind of put it there between like the 14 and 15 days to like separate it just for research purposes. But, you know, depending on how bad your migraine attacks are, if they are very debilitating, like, you know, you should be on preventive medications just in general. Because we're starting to see more, I don't know if we're starting to see more about being able to like identify like the rare type of headache or a rare type of migraine, which is hemiplegic migraine, where you basically looks like you have a stroke. So it can be severe as like feeling like you have a stroke on one side of your body that just resolves once your migraine attack resolves. Or it can be, you know, kind of like get limb weakness there. Because I think that's what Marcy was experiencing. When I was working with my co-author, I was telling him about her symptoms, and that's what he asked. I was like, sure, she didn't have hemiplegic. And I'm like, you know what? Now that I think about it, probably did. But,
Yeah.
But it's kind of, because they definitely one of the things that they recommended to like do further studies would be to look into like, okay, what's going on with this genetic factor, you know, is this, similar to the gene mutations that they've already seen, which I cannot name off the top of my head. One of them sticking in my mind, but what exactly it does, because like one process is glutamate, other gene mutation has something to do with like the potassium sodium pumps in your system. I cannot remember all of them right now.
That's okay. I didn't bring you here to teach a whole lesson.
Right.
What do you think, as like family members, as people in community, like what do you think is the best approach? Should you have a family member or someone in your home that has migraines on a regular basis, or you think they're migraines, they're a little bit more than a headache? What do you think they should be doing?
Honestly, I think they should be just, advocating for themselves to be treated, because we have so many working in the clinic, we have so many people that just walk through life like, oh yeah, I get them too. How often do you get them? Oh, like twice a week or something like that. And I'm like, you didn't say anything?
Wow.
I'm like, I get, most people are, I think a lot of people are just like, oh, we'll just power through it, deal with it later. But, there's only so much that you can push off. So, I think it just kind of all depends on, like, I guess the upbringing, because how many times have we told them, like, oh, just walk it off.
Yeah.
Keep going.
No, absolutely. I think
Right.
after I got married, like that winter, right after that, I was in the hospital for a week because I had the worst migraine of my whole life. Mm-hmm. And at that time, I didn't know, like when you get Hep A from like bad seafood or whatever, mm-hmm. like when you get that, it exacerbates something in your system, right? Like,
no kidding.
Like, so my mom went to a Chinese food restaurant and she got Hep A, and then she ended up in the hospital and she almost died. And then like that same year, I went to like a Thai food place in Ithaca and I got Hep A. And then I got a migraine for a week straight, and I couldn't see light. I had to keep like my head covered. They were giving me all sorts of stuff, and they did a CAT scan and they said, "Oh, well, you have unaffected cysts in your brain." And I said, "Okay." So whenever I have a migraine, it's like those cysts, there's like a seizure, mm-hmm. in like mini seizures. So I have to take the medication to stop them. So it's like, yeah. I was like, well, why isn't that a worry? Like, mm-hmm. I was like, is that why I'm smart? Like, I don't know. Like, I don't know. Like, I never looked into it any more than that. But I know, mm-hmm. now that I'm on the medication, I get like maybe one migraine every couple months, and it'll take me out for a day or half a day, but it's not like a full day incapacitation. Mm-hmm. And I see neuro on a regular basis to check in. But it's like, how many other people are getting that or have that, and they just don't even realize. And those are the people that have like aneurysms or like, mm-hmm. like how far does it go? And mm-hmm. so I think it'd be really great to just have that support group, but also like normalize the conversations, to make sure that people understand that it's not normal.
Right.
Or that it's not okay. It is normal for people to have them, especially around community, but it's not normal to just live with it.
Right. Because, especially it over time, you can go from episodic to chronic. Mm. You can fluctuate between the both of them, to be honest. And what's kind of crazy is because your brain, how it processes pain, pain has a purpose. And I was just telling some people about it this week that, it's there to tell you, pain is there to tell you like, okay, something's wrong. We need to, don't do that. There, as kids there, we learn not to, fuck around, find out,
right.
If it hurts, you probably shouldn't have done it.
Right.
So, but when it comes to like having like this chronic pain syndrome there, it takes a toll on you mentally, because you've probably been there where you're like, okay, what the hell do I do? I'm like afraid to go out into these social situations because I'm afraid to have a migraine attack there midway through. Yeah. People do a lot of work to figure out what their triggers are, and then they also do a lot of work to try and avoid their triggers. But depending on what it is, it can be pretty socially isolating too.
Yeah, absolutely.
So, because it's because it's kind of hit or miss, even the research is kind of back and forth on like, should you really limit yourself that much, if you have certain triggers and, you just want to enjoy your life. So,
Well, then you'd have to have like a contingency plan if you go out and then you get a migraine and then you can't drive,
Yeah.
you can't travel, you have to be in the dark.
Yep.
That is not a safe plan, right? That doesn't
Right.
make any sense, even if you do want to be social. So it's like you either decide. And normally when I get a migraine, I'll wake up and I'll start to feel like I can feel that my head is just kind of tender, and then it grows. All day until it hits hard. Like it's like a crescendo of pain, right? So I'm like, okay, yeah, I'm not doing very much today. That's not gonna happen.
Right.
But it's like, how do you live with that kind of a condition and have a normal life, or you just kind of bob and weave around it?
Right.
But it's not fair to have that kind of quality of life.
Right. So, and that's kind of why, opening up that conversation is important, because, there are treatments. Like, the treatment landscape for migraine right now is pretty freaking wide. So, because we have nutraceuticals that, will help, because magnesium has been shown to help with migraine prevention. We now have neuromodulation devices. There's a couple that you can buy over the counter that are, one is pretty new. I think somebody just posted in the Migraine Mavens group that's going on. It's a lot of like female medical professionals that are migraine
brain study people.
Yes. Somebody just posted a question about one, and that's like kind of sits on your ear is what it looks like, and then kind of sends impulses that way. I have to look a little bit more into it, because right now I have the Cephaly device, and this is one that kind of sits on top of your forehead, and it sends, like, think about it like a TENS unit.
Yeah.
It sends electrical stimulation through your ophthalmic nerve and kind of works to disrupt the migraine pathway that way. And then Gamma Core, which
So you can shock yourself at home.
Yes. Which I know I posted on TikTok at one point about that, and I'm like sitting there with my migraine attack. They're wearing the Cephaly device. I never posted a response to it though, because I have some thoughts about the sensations that I felt during that. They're really quite funny because just like how I felt afterwards and then like during it, it was kind of funny. Of course my brain goes to like, I'm gonna make a joke about everything that's going on
as you shock yourself at home and videotape it.
Pretty much. But because there's that one, the Gamma Core, which stimulates your vagus nerve, and it looks pretty cool. And it's funny because when I explain it to patients there, I'm like, yeah, it kind of looks like a taser that you put up against your neck.
Oh my God.
But you're not going to shock yourself that bad, okay? It's just some light stimulation. Because there's somebody else that another Instagram like influencer that I follow there that has been living with migraines since she was 16, and you get to see her try all of these different products, and and she has a video of her using the Gamma Core there as part of her migraine treatment, because she was one that just did not respond to a lot of treatment. She went through, like, they even got her to doing the Botox injections, and she did respond, but I want to say it worked for a while until it didn't. And then they were back to square one, like, okay, we got to figure out what to treat.
It's just a Band-Aid.
Yeah, it was pretty much just a Band-Aid. But what was cool is I got to did a Zoom meeting with the Gamma Core reps there, and what they're trying to do with, like, how to, like, the applications for that device there seems pretty wide, because just how much the vagus nerve does. They've seen it, you trying to work with the VA health system, use it for PTSD treatments. And then we're doing some sort of study that I think wrapped up this winter, and I think they're just waiting, like going through the data right now on using it for post-COVID shortness of breath. So, right?
That's a lot of different applications. That's interesting.
Yeah, it was such a wide range of applications for it. And I'm like, I'm really interested in, seeing how this plays out.
Now, is this a pocket-sized device you can, like, walk around and zap people with, or?
No. I mean, it's probably about, like, the size of your palm, but no, you can't zap people. You need the electrogel for it to work, so.
There's always a catch.
I better make sure that nobody tries to, like, taser themselves in the neck, because they're
know.
so desperate. I mean, yeah, because, like, the applications for that one, they're kind of fall over into cluster headache, which is a very rare headache disorder that often gets misdiagnosed for migraine. And one of the biggest things between those two is like during a migraine attack, like, or during a cluster headache attack there, they can be pretty, that one is actually pretty debilitating. So, and I was just listening to somebody recently that was talking about like one of the biggest things between those is like, okay, when you're in the middle of a migraine attack, you want to go sit in a dark room and lie down. And what can happen quite often during a cluster headache attack is they become like very agitated and they pace.
Oh.
During their attack, they're pacing. So, you know, they just can't sit down. So, you know, whereas migraine, you move a little bit there, you move the wrong way, you're going to hurt worse.
Yeah.
So,
you got to sit in the exact spot that makes you feel better and hold pressure in the exact spot. And
right.
It's a hard road. Like
it is.
I didn't realize how many people in our family have migraines until I started getting like diagnosed and getting my medication and stuff and talking to Aunt Guddy and everybody and I was just like, there's a lot of us. Like there's like 4 or 5 of us, 6 of us that get them on a regular basis just in our family.
Oh yeah.
And it's like, how do we prevent that, or what in our upbringing brought those on, or what in our grandparents' upbringing, you know, because it's definitely on that side of the family. So it's just interesting to hear how many, and I wonder how many families are like that and we just aren't talking about it.
Right.
And it's the awareness that's so important, you know, like I don't know if my daughter had migraines, and I've seen like when I started getting them when I was like 11, and that's so young to be in that much pain, you know, 11, 12 years old, and I thought it was like, oh, I'm just sick, but it was something completely different. So I'm glad I know now what I didn't know then, so I can give her the support should that happen, and we can do preventative measures right away, so it's not taking away from her quality of life, because it does.
Yeah. I mean, especially these people that walk around not being treated, it has, like, when you don't get the adequate treatment that you need, it can just snowball into getting more frequent, you know, the longer it goes on. So, I mean, you know, there are people that are pretty fortunate that they're like, oh yeah, you know, they just went away, which was great for them, you know, but not everybody is that fortunate, you know, and they find, especially for women, they're the most frequent your migraine attacks are when you're in your most productive years. So when you're developing a career at the height of your career, and then when you're ready to retire.
Yeah.
Like, you just see like you look at the charts and like the diagrams on like when you're the most effective, and it's like, so you're telling me when I'm supposed to be the best boss bitch I can be, I'm just gonna be in the most pain.
Yeah.
So, you know, which sucks, but you know, like I said, right now we just have to, you know, get that conversation going amongst the community, which is one of the biggest reasons why I wanted to start, like, you know, just like an Indigenous headache network. So, you know, I really kind of going back and forth on how exactly I want it to be kind of designed, but I think mainly it's just for the community members, you know, do I want to just keep it here, or do I just want to open it up to, you know, everybody, you know, all of the tribes, especially because, you know, we often see like how many of our community members are, you know, experiencing them. And it was funny because I had like patients there recently. They were like, yeah, I've also asked, like, you know, I was telling people about what I experienced, and then come to find out, oh yeah, so I get them too. Or, you know, and they're like, we don't talk about it. They said the same exact thing. Like, this is not being talked about as well as it should be. So
I think there's a lot of things, just growing up, like suck it up and deal. Good, it's gonna go away. Don't worry about it. You know, like there's just that that's an understanding in the family, and we don't want to bother anybody with that. And just go lay down, come back out when you're ready. That kind of thing. And I think that's with a lot of different ailments, but also the mistrust in the medical field to be getting the treatment or wanting to go to the doctor, or plus the lack of access because it's expensive. So there's like multiple factors as to why our ancestors never talked about it, and now here we are trying to talk about it, but how much do you say without having to get like a CAT scan or like it's scary, you know, like, and I think with healthcare in general, like people need like good support and good advocacy and clear understanding, because a lot of people don't get that, and they only get it when all of a sudden they're diagnosed with stage 4 and they're going to the doctor all the time for treatment instead of doing the preventative with people that they trust. So it's a big systemic issue for real.
Right. Yeah, because there are some like red flags in, I want to say, over it on Akwesasne TV. So, you know, to kind of help, like, because anytime, like, if you get migraine attacks, most of the time, like, your imaging is going to be normal. It's when we start seeing this sudden swing where it's like, okay, so for me, you know, I got them every 2 years. I did actually get more attacks this year. You know, go figure. I get more migraines while I'm working on a paper about migraines.
That makes sense.
You know,
it's the stress.
It was a labor of love on my part, and I did hit a wall for a while, and I was stressed out. So, you know, trying to get that going, and I ended up actually for the first time in my life there. Well, for one, it was like, okay, I had an attack 6 months ago. What? Okay. And then it went from, oh, I had an attack 3 months ago. And then it was just like December and January, I had an attack 1 month back to back. So that gradual change in the, you know, increased frequency, I technically would not have qualified for getting a CT scan, you know, or an MRI. Just because it was a gradual increase. You know, there's probably a lot of lifestyle factors there that could have played into it. Whereas if I had gone from one every 2 years to like all of a sudden, I'm like, dude, I'm getting them every other day, or they're almost every day at this point, you know, that is a sudden switch. That's like, okay, something could very well be going wrong, you know, so, or if it all of a sudden like, okay, I'm getting them every other day, but now I have new symptoms that were never there before. It's just all of a sudden they're just very dramatic, you know, in presentation, like, because you talk about, you know, like we said with like the hemiplegic migraines there, you look like you're about ready to have a stroke, you know, which was never an issue for me. I think I got maybe numbness in one side of my hand, or like a couple of attacks there. I think I got the numbness in my hand. But for me to go from like, okay, the numbness to all of a sudden I'm experiencing migraines where I'm losing functioning, that's a dramatic turn that needs to be investigated. Yeah.
Yeah, and I don't think a lot of people are self-aware with their body. Like, I know I wasn't. Like, when I get a migraine, I don't pay attention to the rest of my body. I'm just like, okay, I'm in pain.
Right.
And I don't think I've ever really noticed, and maybe I'll try and check in next time to see, is there any other kind of, like, am I immobile in any other way, or do I have any kind of nerve situations with my hands? Because I don't think I've ever really thought about that.
Right.
But nobody tells you that you should. Or like, because they're like mini seizures or whatever, like I just automatically assume that I'm gonna feel some sort of way, but I've never really checked in.
Right.
So I think that's a good thing too, like even just like a handout, be like, are you having migraines?
Oh yeah.
Are they this frequency? Are they this or that? Because I don't think people know that at all.
No.
Like, besides not talking about it, but just not knowing what's really happening with your body at the same time. Like, that's kind of blowing my mind. And you calling it an attack instead of just it being a migraine, like, that makes so much sense to me. It's like an attack on my brain.
Right? Because there is some work with, like, CHAMP is actually trying to change the language, too. And instead of saying, like, oh, migraineur, where you're just, like, identifying with your disease, it's now, like, you are a person who experiences migraine. You live with migraine. You know, it's just something that, okay, is a part of your life, but it is not your whole life. This is not your whole identity. So,
and I've never thought of it as like a condition like that either. It's like, oh, I get them.
Yeah.
And I take medicine for them, probably for the rest of my life.
Right.
But I never and I was hospitalized for them, but I never thought like, I'm a person who has migraines, and that's part of, like, when they ask you at the doctor, like, what do you take for medication and what kind of conditions do you have? Like, I never list, I tell them my medication, but I never list, like, I'm a person who gets migraines.
Right.
And I should, like, that would make sense, especially
Yeah.
with all the other things that happen. Like,
Right.
it's a contributing factor.
Right. Because according to the World Health Organization, I want to say it's like second, probably, I still have to work like primary care, so I'm like doing my best to hold on to like all of this knowledge. It's like the second or third disabling disorder across the world.
Wow.
So, that is how prevalent it is, like just worldwide. And, the amount of like productive hours lost due to attacks there, it's actually pretty astounding there when you start like digging more into it.
Yeah, I don't want to think about that.
Right? So, but yeah, I had never, like, there was so much that I didn't know going into it, and like all these different like crazy headache disorders, because like you can get what's called like a hypnic headache, meaning that you wake up at like 2 o'clock in the morning, 3 o'clock in the morning, like 4 o'clock in the morning with a headache. Like the headache wakes you up.
Oh yeah, I get those.
Yeah. So one of those could be like a sign of undiagnosed sleep apnea. Once you treat the underlying condition, it usually like kind of improves.
Yeah,
I'm not going to say it goes away, but
I used to get them a lot when I had sleep apnea, and then I lost the weight, and I no longer have sleep apnea because I used to have a machine and everything. But before I had weight loss surgery, and I used to wake up with the migraines.
yeah.
Like that. I didn't know what it was called, but
Yeah.
learning
Right.
so much stuff about my body.
Right?
Take care of yourself.
I know.
Oh my
Yeah.
God.
So one new development that happened yesterday, and my face is now on a website, which is kind of exciting.
Yeah, fancy pants.
Right? So I'm now on the Advanced Practice Provider Committee for the Association of Migraine Disorders. So,
Wow.
which has just happened, which was pretty cool. And I'm really glad because
Fucking bossing it up.
Exactly. I'm trying to make it, like, I'm in the early stages of like trying to get things moving within IHS. I think right now it's just pretty much like doing my best to improve things within my own clinic, and then like, okay, take that information and be like, how can I translate this to other facilities? Because, it's one of those things where, because how our facility runs, there is not like, all the facilities are not made the same. They don't all run the same. We all don't have the same exact needs. I mean, there's a lot of like things that kind of overlap across the board, but I find a lot of times like over here, some of it has to do with like vitamin D deficiency, because that can increase your increase your attack frequency. It kind of inadvertently, because the study that I read basically said that vitamin D acts as an anti-inflammatory. So if you're low on that, it just I understood it that you might be triggered a little bit more easily. So, and I have seen it with a couple patients that as soon as I fixed their vitamin D deficiency, boom, attack frequency went down.
That's amazing.
Yeah.
No, I am like severely anemic, and that was something that contributed. And it's like, it's like when you have migraines, you're kind of like a delicate like system where you have to figure out what's going to keep you in balance so you're not going to get them. You're like, I got to drink all my water. I got to take all my medicine. I got to make sure I eat healthy. And if I don't, and if I'm like fucking around, I'm going to get a migraine at the end of the week. I know I'm gonna, because I'm not treating my body the way that I should.
Right.
And a lot of people don't think of it like that. Or they're just too busy to be mindful.
Right.
And it's damaging, because I know after I have a migraine, it takes me a couple days to kind of feel normal again, where I can be like fully productive. And that's hard, because I have a little, and she needs all my time. And so she don't care if I don't feel fully productive,
Right.
So
yeah. And it's kind of funny because, well, not so much funny, but it's kind of interesting there. Like when you look at like how the migraine pathway starts, you have this prodromal period. Like they basically lay it out essentially like how seizures occur. You have a prodromal period. If you're somebody who experiences migraine with aura, which happens in like 12% of people with migraine, I'm one of them. Marcy's one of them, which is kind of, And apparently Andre started developing them too. So he's had them, but he also has like a history of like concussions there. So, you know, that probably contributed to it. But he never had migraine with aura before. And then all of a sudden he like text messages me, and he texts me and he's like, why does it look like I'm seeing Predator in front of me, just like morph in front of me? And I'm like, I've had like these aura attacks, like, you know, since I was 17. And I'm like, I never once thought of it as Predator in front of me. So now I have to create a little thing, like going through like the different types of aura, finishing it off with, and then we see Predator. Don't worry, people, there. You don't have to defend yourself with like the hatchet there, the throwing hatchet there. It's just a migraine attack. I gotta find a way to like merge those there so that it's funny. Because,
Do it.
you know,
I can see that.
Make light of like our symptoms.
For real.
Right? And then, you know, you have the attack itself there, which is like the head pain. You can get the nausea before or after. And then you also have like the photophobia, which honestly can start before the attack, you know, before it's in full swing. And then you have that post-drome period where, you know, you just feel so worn out. I've had people tell me that they feel like they're hungover. You know, it's just... It's such a huge...
You're like speaking my truth right now.
Right.
No, and I don't think I think I'm like the only one that ever gets them. Or I know I've talked to like Louis and Abby, and I know Louis gets them pretty bad. And he's never been treated for them. And I was like, you have to go. And he's like a stubborn shit, you know? So he's not going to go. And I'm like, you have to go get treated, because I did, and I got medication and I'm a lot better. I get them maybe one every couple months, you know? And and that's way better than it was. But it was mostly because of screen time and stress and the imbalance of everything. But I always advocate to go get checked out. But people hate the doctor. My husband won't go to the doctor for shit. He's got a pulled muscle in his back. He's like, just rub my back. I'm like, what is wrong with you? Go to the doctor.
He's saying it's like, okay.
He's like, no, I'm not going. I don't want to bother anybody.
Nobody's going to check your prostate for that, okay?
Right? That's what they're worried about. It's like... You know, I think all men, they're afraid. They're afraid that someone's going to stick some fingers up them. And they're like, I'm not doing it. So they don't go to the doctor. That's what it is. The mistrust.
Right?
It's fucking real.
I feel like we should turn the camera towards Josh right now.
He's dying. Like the boundaries are blurred.
Exactly.
From medical practitioner to community. Like she's seen different sides of you all.
Exactly. Just remember, okay? And I like tell everybody, because, you know, I have my well woman days, and I tell them, I'm like, you're in control of this whole visit, okay? If anything feels uncomfortable, you need me to stop, let me know. We can stop. It's all right. You know?
So do you walk around the grocery store and you're like, yep, seen hers? Yep, seen hers? Like,
nope.
Not out loud, but in your head.
Right? No. It's one of those things where you've seen one, you've seen them all at this point there. Yeah. So, you know, unless there's like very discerning, like, you know, key details, or you're like, yeah, I'm not going to forget that. It doesn't do you any good there to kind of like keep all of that stuff in your head. It's because,
like in one ear out the other, like making sure you're safe. That's good for me.
And for me, it's also setting that boundary of like, okay, you keep work at work. All right.
Oh yeah.
Yeah. Because I know, like, I've ran into patients that are asking me about, like, things
like, in public.
I'm like, I don't have my chart in front of me. I can't tell you anything, okay?
Can you call me at the office on Monday, please?
Right?
I'm not talking to you about your vagina in the grocery store. Thank you.
Yeah, because I'll get, like, messages from people on Facebook Messenger. They're asking me things. And I'm like, heads up. This is not an encrypted message. If my phone gets taken or, like, somebody hacks my phone, you know, this whole conversation they can look at this whole conversation. So, you know.
No, I was such an asshole for that. My mom's like, just text Mary. I'm like, no, I need to stop doing that. She's like, just text her. It's the pandemic. She'll understand. I'm like, no, but I don't want to do that to her.
I mean, emergency situations there are warranted, because I have had those text messages there, and I'm like, no, get your ass to the hospital, okay? Just remember to call on
man.
Monday, okay? Just let us know that you went.
Oh my God. It's just crazy to think of like your position in community and all the things that you've seen or go through and how you have to build that trust,
Yeah.
because you are such a young practitioner in community. I think it's probably not easy to be in our clinic, and I can't ask you to speak on that per se, but I just feel like I feel for you having to, like, we talk about on the podcast, we've always talked about how do you deal with people's energy, like what do you do for self-care, like because you're dealing with so much illness, so much energy, like whether it's mental health or whatever in community, like what do you do at the end of the day to like brush off?
So some days, like, especially in a couple, like within the last few weeks there, I know that I was always getting like just overwhelmed, and it was so hard to focus. Like, I'll smudge. There was like a couple weeks ago, honestly, like every day I was coming home just like smudging. I smudged my house, I smudged myself, I smudged my kids, just because there was just something that I could not shake. And a lot of it too was like, because I can get behind on notes, and of course I have that looming over my head, because if I don't get my notes in on time, we can't bill. If they see another provider there, well, there's information that provider can't see because, hey, I'm behind on my notes, or forgot to do a referral. Which, I'm human, it happens. And then we all, we tell people like, okay, if you haven't heard anything within like 2 weeks of like this appointment, call, because, and I'll tell people, I'm like, because I am able to like log onto the computer in the room, and I have done it for people where I'll do the referrals. I'm like, you saw me do that, right? If you haven't heard back, call referral department. And then there's times that I don't have the time to do the referral because I need to go through their information and make sure that those key parts are in the referral. And because we'll get questions there as to like, okay, why are you ordering this, or why was this referral done there? And I'm like, it's literally in this little box of information that I sent you. So, and they'll kind of question stuff like that. But I am human, it does happen. And I told them like, you got to keep me honest here, because you need to, I empower people to be on top of their own health care too, because, it's not just like, okay, here's all my problems, fix it. It's like, okay, you need to be an active participant in your own health care. And especially with like dealing with people with mental health issues, saying that when they're like, in the throes of depression, they're easier said than done.
Oh, absolutely. Absolutely.
So,
yeah.
No.
Well, no, I just wanted to thank you for coming in and sharing all your brilliance, because you're brilliant, and I love you, and I'm proud of you. And that's super cheesy. But no, I think it's really important for people to know who you are, and to know that you are in our community and you're really looking after our people, and that makes me proud to be your family member, and I know Ditto would be proud of you. So I just think it's really amazing. And so be nice to my cousin. She's human. If you fuck with her, I'm gonna find you. But no, she holds her own.
I'm able to hold my own. It's okay. I never take it like personally, because I'm like, I may not be for everybody, or like, because you want to have that good rapport with your provider. And, if we're not connecting and like, understanding each other, it's fine. If you need to find another provider, that's fine,
Right? Yeah.
So.
Mm-hmm. All right. Well, I want to thank you for coming. You got any last words?
Oh, for the most part, if you have any issues with headaches there, come see me, come see me, or talk to your provider about it. If you feel like they don't really have like, much background in headache medicine, because it's hit or miss there with providers on like how much they know, which is kind of scary. And that's part of the headache movement, is to make people more, educated, not just providers, but, the general public, more aware of treatments. So, come find me at the clinic. Might be a couple weeks to get in to see me, but just a heads up.
Worth the wait. Take care of your body. Find your balance. Find a provider you can trust. We care about you. Thanks for joining Woman's Dance today.
Yeah, well, for inviting me.
Have a good night, everyone. Ona.
No.